Behind the Glow, inside the world of plastic surgery. I'm your host, Dominique the Diva, and I'm here with Dr. Gabriel Santiago at the Glow Plastic Surgery in a new location, might I add.
Totally brand new. It's my first time here actually in the office.
Yeah, it's
still under some construction a little bit.
Just a little bit, but look, it'll be ready for you when you're ready to come through.
Absolutely.
So today, in every episode, we'll be going through all the secrets of plastic surgery, from all of the aesthetics to post-op, pre-op, and everything you need to know. And girl, I've been right where you are. So please understand, I'm going to ask all the questions so we can get the real deal on what it really takes to have a successful surgery. So thank you so much, Dr.
Thank you
Santiago.
so much for agreeing to come here. You are one of my best and also most famous patients. And I think it's really great that you've agreed to help educate so many people out there that have so many questions and have seen some of the craziest stuff out there on the internet about plastic surgery. And you're doing a great service to allow them to kind of get what the real deal is from somebody who's had it done.
See, one thing that stuck out, because, you know, when you decide that you're going to do surgery, the first thing you do is research. And one thing that stuck out to me about you is your ability to do bodies that look absolutely natural. And so if I'm a young lady and I'm thinking about it, because we all do, what are one of the first things that they should really look into when they're trying to find the perfect surgeon?
Word of mouth. If you know someone who's had surgery and you think they had a good result, talk to them, ask them about their experience. There's, always this edge in terms of, from the plastic surgery side, whatever practice you look in, it's a business, and they're only going to market their absolute best stuff. That's just how it is. But if you want the real unvarnished view, if you have somebody that's gone to that person, that's a really good first step. If you don't, looking at reviews and seeing, hey, well, have people had the surgery? What are they saying? Google, in terms of finding a plastic surgeon, it kind of cuts two ways.
Okay.
The one issue with it is there are surgeons or surgical practices that may have thousands and thousands and thousands of dollars, and they're going to boost themselves at the top. And they may not be as great at plastic surgery, but
that search engine's going to have them.
And if you, I don't want to disparage any practice, but for example, just in general, chains.
Okay.
Just like there's McDonald's, there's also chains that offer surgery.
Yeah, we're going to get
they're going to have a big budget for marketing and things like that. So those are maybe the things, if you're looking for surgery. Some of those companies that have the bigger budgets, the bigger marketing, those might pop up first.
Okay, so let's tell them about my first experience with you.
Yes.
The first go around, we did a weight liposuction, and that was something that I tell people about, and we went live about it. They could not believe that I was awake the entire time.
Yeah.
And one thing I appreciated about it was, well, you answering all of my questions and never making me feel rushed or that it was a silly question. You were just there with me the entire time, and from what I understand, allowing the numbing to actually take place before going to work. I'm like, I can't believe I'm awake right now.
Yeah, so we did this soon after you had your son, I believe.
Yeah.
And did on you the abdomen, your back, what we call 360 all the way around.
Yes, we did.
And you tolerated it really well, actually.
You said that, but that's also because I had Rihanna playing.
Yeah.
I had a playlist going. But, it was after I had a baby, and so many women want to just feel like they're self again, or at least confident, and get rid of that baby fat. But I didn't have I wouldn't say an excessive amount of fat around that particular area.
Right.
But if you know that you want those really, really good results, I say, after having both, knock me out every time, doc.
Yeah. It sounds like a joke, but all these patients that would come in and say, oh, I have a great pain tolerance, those were the ones where we would start doing the surgery, and they're like, I can't take it anymore.
No,
and all the ones that were all nervous about it flew through. So I couldn't predict. There's no way to predict who's going to sit there and be able to get through the whole surgery awake and
do the J plasma afterwards.
And
I remember
the skin tightening,
feeling
exactly.
that. Let's talk a little bit for the young lady that's like, okay, I'm trying to decide what kind of surgery I should get, and I didn't even know it was awake.
Yeah.
What would be a good candidate for that, or maybe why should they think about getting put to sleep?
Well, there's a lot of people that want to do this awake. For whatever reason, they have an aversion to going to sleep, and I'm going to take care of them. As long as they're okay with the fact that I'm not going to be able to get all the fat out that I want to get.
Yeah.
What I was running into is patients who wanted to look amazing on their first time. I had to kind of explain to them, you're going to require multiple treatments, or by the end of their process, if they really went through it the entire time using non-invasive, they spent the same or more money than they would have spent just getting one surgery done, healed in a much shorter time period.
Let's break down BMI, because maybe someone with a lower BMI would be a better candidate for awake versus...
I would say it's actually the opposite.
Oh.
Yeah, because patient who has a low BMI, that layer between their skin and their fat is thinner. So almost immediately as I start to take out fat, that cannula, which is like a metal suction tube, starts irritating that muscle. The fascia is what covers muscle, starts irritating that, and they really... they feel it no matter how much numbing I put in, because those nerves that control the muscle are separate from the ones that are controlling the sensation of the fat underneath.
I love how you were able to debunk that right there.
Yeah.
And that's what we're here for.
Yep.
So what about high BMI patients? Because I hear that you specialize in BMI patients and giving them a natural results.
Yes. So I want to also kind of define the natural result, because what I've seen in a lot of... because I'm looking at everybody else's marketing as well. I notice a lot of plastic surgeons do very minimal surgery, and they say their justification is, oh, I'm giving a natural result.
Oh, I see.
That is not the surgeon that you want, at least if you want to look different, which is what I think most people are paying for.
Yeah.
So the natural results I'm trying to deliver are not to make it look like you didn't have surgery. It's to make it look, whatever I transform your body into looks natural.
Right.
Like, you were born, you just happen to be born with a six-pack.
Yes. That's what I tell people.
When I'm doing surgery, I don't think that way. I have a vision of what I want to achieve, and I try to make it look like that. And some surgeons that are very technical, they think that kind of the engineering, mathematical approach to a body is going to take care of itself.
Okay.
And it doesn't always happen. Just look at the results. I mean,
that's what we do. We get to searching on social media, hashtagging, and then that's when that word of mouth comes in. So what if I know I want surgery, but I just don't know which one to get? Because what I'm finding is after doing lipo twice, people still are like, girl, how was your tummy tuck? And I'm like, wait a minute, did you guys really pay attention to the exact procedure that we did?
Yeah.
We say the most times patients, they already kind of know.
I'd say half the time when they're like, they come in, they're like, doctor, I need an abdominoplasty, J-plasma skin tightening. I want a liposuction this area. I'm like, okay, well, all right. You don't need me. Just here we go. Let's sign up. We'll get you done. But, even those patients that can identify probably what surgeries they need, there's always nuances that have to be explained. So,
do you think that it would be, most helpful if a patient is, actively trying to get to their closest, body goals before, laying down on the table?
What I found often is patients who are, for example, coming in for liposuction. A lot of them have gotten down to a certain weight at the cost of a major lifestyle change, which is not really sustainable. So it's easy to lose weight when you have motivation. It's easy to go to the gym when you have motivation. When you don't have motivation, it's very hard. And so these patients come in and they're like, oh, I'm going to get as skinny as I possibly can, and then I'll go have a tiny bit of lipo, and that'll be perfect. But then, life happens, and they go down and up and down and up. Oftentimes, when patients come in and they need some liposuction, I tell them, well, I know you're thinking about dieting, you're thinking about losing a few extra pounds, but in your case, in this theoretical patient, if I can just remove the fat, you don't have to diet, yo-yo. You'll have your body. You just have to maintain. You just have to maintain. Don't be on a weight gain cycle. Just be on a I'm not gaining weight cycle. When I remove the fat, you have that body. You just have to maintain it. You don't have to starve yourself or anything like that. So that, especially for busy people, especially in this area.
I was just about to say.
I mean,
let me tell you.
That takes a lot of stress off people. It's like, I look good. I don't have to do anything crazy with my diet or anything to maintain this.
Yes. I'm going to keep it real with you. That was my favorite part after we did surgery, did my lipo, is the fact that now I'm just maintaining it. I'm just actively, looking at the nutrition and everything, and actively, working out, staying active because we're so busy. Yeah. But the fact that I feel like, okay, I already have what I want and I just have to keep it, that takes a lot of pressure off of anyone that's a working mom or anyone. Like, that's the best part, just maintaining it.
Yeah, because you're so busy in radio and media to get the results that you got, and they'll probably post them up in the corner. But you had an incredible frame. I just had to take out a little bit of fat for it to pop.
Yeah.
And if you were to try to get that on your own, you just couldn't work. It would just be a full-time job of you trying to get down there.
I had so many comments on there, Dr. Santiago, and they were like, oh my goodness, if she would have just went to the gym for 9 months, she could have got that. And I'm like, honey, I don't have that type of time. Mm-hmm. And so here we are 2 weeks later, and I was just fine.
Yeah.
So don't worry about that. You have to do this for you. Just do your research and, figure out how you're comfortable and exactly what you want to do. That would be my advice for anyone right now. So let's talk about, we already talked about BMI, but what if someone comes to you and they're like, look, I want a lot of fat taken out. How much can you really take out?
The general guideline is 5 liters maximum. And the reason, which is a lot of fat, actually. I mean, even high BMI patients in the 40 range, 40 and under is typically what we see. 5 liters of fat still makes a big difference. I've learned this over time where I just assumed that patient knew that I could only take 5 liters, and they come back and like, oh, that doctor wasn't aggressive. Oh, my and I'm like, oh, I'm aggressive.
Yes.
If there's one thing, I will get as much fat out as your body will give me very safely. But there is a limit. 5 liters, like I said, even in a patient with a BMI of 40 is going to make a difference. Are they going to have a 6-pack after that one surgery? Probably not. Those are the ones that we tell, all right, your goal is, if you want to get liposuction, you want to look better in your clothes, you want to feel a little healthier, you want a nice motivational boost, like you got the surgery, you paid money, you're going to keep it going, and you can do the rest. Those are good patients that come in, but those are ones that also we can tell them, if you want more, we can do it, but you have to heal, at least for liposuction, for example, 3 months before you get a second round.
Okay. That makes a lot of sense. So with that being said, every state is different laws, different guidelines. There was one part where I felt like so many people were going to Florida. Do you know what that is?
We get called all the time of patients saying, I got this price, but I got this price in Florida, and if you can match it, I'll do it.
Okay.
And the thing is, this is how I explain it to them. Nurses cost pretty much the same everywhere. Expensive labor. Facilities cost pretty much the same everywhere. Medications, equipment, all this stuff costs the same, right? There's nothing magical about Florida that they can do it so much cheaper. The only way they can offer that surgery for so much cheaper than we do here or any other place that's offering, I would say, what is closer to the average, is they have to cycle through multiple patients in a day. So they're doing 6, 7, 8 liposuction cases in a day. I mean, and this is not me making this up. These are patients that have gone to these places, come back, tell me their experience, tell me, if I'm a plastic surgeon, there's no way I can do 7 of anything in a day, let alone try to have as much focus on the art and try to make make somebody look as good as possible.
It's like an assembly line kind of.
It's assembly line.
Yeah, I actually had some girlfriends with crazy experiences. Like I had one say her doctor switched her time and was like, "Hey, can we do 9 p.m.?" Would that be a red flag?
I would say that's a red flag.
I also had a friend who, deposited for, I think she was getting her tummy done as well as a BBL. But, when she got there, they said, look, you need to choose one or the other. We're not going to be able to do both today. You're just going to have to book a flight back down here and we'll get it done another time. And I still I don't know if she went, got the second part that she initially paid for. So it's interesting. I guess another, thing you should look for is how many surgeries is your doctor doing in one day?
Yeah.
Is that an invasive question? Is that if I was to ask you that?
I think you should ask that question. Yeah, because I think I'm pretty fast at doing liposuction, and I still only really do 2 a day.
How long should one take?
So for like the most common lipo 360, which is abdomen, flanks, back region, depending on the BMI, but on average for me, it's somewhere between 2 to 3 hours. Okay. And that's for one person.
2 to 3 hours per
person. So if your surgeon is doing 7 in a day, they're probably, I don't know what they're doing. I mean, I know what they're doing. They come back and I have to fix it. But that's a red flag.
It made me think about when my dad gives me advice about mechanics. It's like, they can get it done faster than that. They just, charging you for labor and, taking a break, coming back. Yeah. What if they're getting, more than one thing at one time? I mean, I have to be honest. Sometimes I get weary, afraid for certain women who have a baby and then they want to get their mommy makeover as soon as possible. Is there a certain time, or how do you know how long they should wait before they could do something like that?
I think a lot of women are looking for abdominoplasties, tummy tucks. In this time period, right around when a woman has a baby, they're actually in a state where they're at higher risk of blood clots. Because the body has prepared itself to have a baby and an expectation that the woman might bleed during surgery. So the body is ready to clot blood.
Wow, I did not know that.
Easier than when they're outside of this postpartum period.
I did not know that.
There's no super hard guidelines, but I would say 6 months is probably the minimum.
Yeah.
After having a baby to have something like an abdominoplasty. Mm-hmm. Abdominoplasty specifically because when we do that, we remove skin, but probably a big part of that benefit of abdominoplasty is tightening those stomach muscles. When that happens, that vein, the inferior vena cava that brings blood from the legs, it gets compressed by us repairing that muscle, and it slows the blood in the legs. That's why patients are at higher risk right after a tummy tuck of having blood clots.
Okay.
So you don't want that just baseline risk that comes with the surgery itself on top of being recently having had a pregnancy risk. You want to isolate those things.
Wow.
So for us, I don't want really anybody before 6 months for that specific surgery. And then all my patients, whether they've had a pregnancy or not, they all get blood thinner prophylactically to help avoid blood clots. So there's ways to mitigate those risks, but specifically for tummy tuck, 6 months. For liposuction, you don't have necessarily all those risks of blood clotting because liposuction is it's a subcutaneous surgery. We're not going in and around the muscles or anything like that. So maybe closer to 3 or 4 months for that type of procedure, but for tummy tuck, for sure, 6 is probably, I think, the earliest.
Mm-hmm. Is that the least invasive surgery? Liposuction, BBL, or tummy tuck? Which one would you
so as far as body contouring, they're all relatively invasive. The difference in a just liposuction is we only use super tiny little incisions, smaller than my pinky nail, and I like to hide them strategic places so you don't see them.
Yeah.
So the incisions heal literally in 2-3 days.
You want to know my favorite incision?
Yeah.
Is that when we did my arms? Oh my God, is my elbow ashy? When we did my arms, I have an incision there somewhere. Do you even see it anymore?
It's hard to find.
Exactly. And if you are finding it, why are you so close to my elbow?
Yeah, that's right.
Mind your business. That's one of the main things with women. We want to know, where's the incision going to be? We don't necessarily want to be walking around showing everyone, exactly when and where, we got done. How do you decide, what's the perfect, how did you know to go through my elbows? Because I was so prepared to, not use my arms for 3 weeks, thinking that we were going to have to, I don't know what I thought we were going to have to do.
Yeah. Natural creases of the body. That's the secret. So the elbow always has, because it bends a lot, natural creases. In females tend to carry a lot of fat above their rib cage, in this area. Yeah. And so I always liposuction this area, and I hide that incision in the natural breast crease, one in the belly button. And I try to go as inside the belly button as I possibly can. So nobody should really be seeing that one.
Because otherwise, back up.
And then, the low, pubic area to the front. So.
Yeah. So what if I come to you and I'm like, you know what? You're just not saying what I really want to hear. I'm just going to get out of here. I have a passport and I'm going to go to DR. What are some things they should look for when looking to get plastic surgery out of the States?
I can't give advice on how to pick a surgeon outside the States because I don't recommend it. Mm-hmm. Mm. Not that surgery can only be done well in America. That's not what I'm saying. Mm-hmm. But the problem doesn't necessarily come with the surgeon itself. It's more so, how can you even know you're going to the right person over there? Right. Like, is this person have a great marketing team? Right. But all his patients die? Or, there's no way to, it's so much harder to verify these things for a surgeon that's out of the country compared to in the United States. So I'm not disparaging international surgeons. We have conferences with surgeons from all over the place. It's just that it's hard from the patient perspective to really know, is this a good practice that I'm going to? Mm-hmm. The second reason I recommend not going out of the country is if something were to happen after surgery.
That's the thing that always gets me.
Plastic surgery is a relatively small community. Everybody knows each other, or at least has a friend of a friend, where, if I have a patient, say, that came down from New York and had an issue and they called me, I at least have a buddy in New York that I can call and be like, hey, can you see this person for me? She doesn't want to travel down and whatever. That's a lot harder to do when, I don't know any surgeons in Dominican Republic. Yeah. And so, and they probably don't know me. So if they call me, I'll be like, what are you sending me? So it's just, we always like every surgery to go perfectly. It's not always the case. And so you want to at least have access to your surgeon relatively easily, or at least if you're, not going to be geographically there, you can communicate with them, and they can communicate with somebody that can help.
One thing I love about Dr. Santiago is he will give you his cell phone number, and you can text him whenever you want to about whatever you want to. Should I eat this? Should I eat that? I'm doing okay. Here's a picture of the blood from last night. You let us bother you, and so I really appreciate that.
Not bothering me at all. But
what if they say, true. Dr. Santiago, I want to go to DR because, they can take so much more fat, and I don't have time to be, footing around. Yeah. I need results, and I need them now.
That's true. They usually do not have those restrictions, but we have those restrictions for a reason. I have a patient that I personally know. She went there. She got a liposuction. She had a great result. But when I was asking her about the experience, she goes, oh, but I did end up in the hospital. It's like, why? She goes, oh, they took out 9 liters, and I had a lot of blood loss, and I had to get blood, and I was in the hospital, and you got to pay cash there. You don't know what you're dealing with. When you're out in a foreign country like that, there's also a lot of people that can take advantage of you. Yeah. When you're in a desperate situation. Mm-hmm. Like, you're in the hospital, you're barely surviving, they give you some blood, and then, they say, oh, here's medication, but we need cash right now if you want to get, a lot of these things can happen.
I've heard
in places like that.
Different stories. I've heard a young lady having a very severe headache after a mommy makeover, and the headache turned into, her unfortunately passing. Well, my main thing is if I'm over here, who's gonna call my mom and call my family and let them know, hey, I need help. And there's just a barrier there that might be, difficult to get around. I
would say it's probably not worth it.
Yeah.
Price should not be the only consideration. The other thing is, in this person's case, she almost died. She happened to get a good result, so she was lucky in that scenario. Yeah. I get a lot of patients that come that got crazy. I don't know what surgery they were told they were going to get, but they got something totally different that did not align with their expectations, and they got botched. I'm always happy to help and fix it.
I was going to ask you that.
It's going to cost them now multiples of what they paid for the first surgery, where they probably could have gotten it up front.
And got it right the first time.
Yes.
So how do you deal with a patient that comes to you that's kind of botched already?
I tend to like those cases, actually. They're a challenge.
You can fix it.
Yeah. I love that show as well.
Yeah.
But the patients that come, they're botched. I can't always promise that I'm going to make them perfect, but there's usually something I can do to make them better. And the way I deal with that person is I just have to let them know what I can achieve.
And be realistic
and just
about
really
it
be
upfront.
very upfront about expectations of, you know, what if I do a revision or I try to fix what was done, I think I can achieve X, Y, and Z.
Has there ever been a time, and be honest, because we're behind the glow right now,
Yeah.
that you've had to decline working? What would be a reason to, you know, of course you don't want to, but what would be a reason that would actually say, you know what, I can't touch this?
I would say the most common reason are patients who sometimes they have so much damage, it's not even going to be safe to try to fix them. I'll give you one example. We had a patient that came in. She wanted liposuction and a BBL. When I go to examine her, in her buttock region, it felt like marbles, which she didn't mention up front. Obviously, you know, no one likes to admit they made mistakes. But when I started digging into it, she had silicone, like construction grade silicone injected into her butt in somebody's basement. And she, you know, had this massive deformity that was, unfortunately, it was not safe to try to take all of that out. And so, you know, those are the tough ones where, you know, they come because I'm kind of like their last hope in the sense of like someone's at least willing to talk to me.
Yeah.
But
after you check
it's something
it
like
out,
that. It's like it's not worth your life.
Like, what is that called? Like silicone in your butt surgery? What is that?
I don't know.
Butt
It was
shots?
probably on some weird.
Because I heard of Fix-A-Flat. I've heard this lady went to jail, prison. Actually, let's be clear, because she was putting Fix-A-Flat.
Yeah.
In butts.
Yes.
Police say Moore has made a business out of performing cut-rate cosmetic procedures using various chemicals like cement or superglue, even Fix-A-Flat, the gunk that's used to seal punctured tires.
It happens a lot.
That's crazy to me. And so do they get it taken out? You have to get it, if you have silicone or you put something back there that your body isn't agreeing with or it's making it marbly or hard, should they get that removed? Because a BBL is just...
Yeah, a BBL is just fat. And so what they're trying to do is, you know, that takes a plastic surgeon to put fat in the buttock, whereas, you know, your buddy could put in silicone. The problem is, it's, number one, it's not designed for that. It's not sterile. Like anything we put in the body has to have zero bacteria.
Yeah, let's not do that.
If it's causing a lot of infection, and infection would be, it's red, there's fluid coming out, or that does have to come out. But if it's not, and it's just in there like a marble, the body often can wall off foreign bodies. So if silicone gets injected in the butt, the reason why her butt felt like there were marbles in it is because her body was protecting herself from it by surrounding that stuff with calcium. And so her body walled it off, and for us to go in and start to try to break that up and remove it was too much of a risk for her.
It'd be a lot. Do you feel like, I feel like maybe like 4 or 5 years ago, BBLs were just like the biggest thing going. I mean, I saw a video online of like an airport and everyone was in a wheelchair because they were coming from getting a BBL. I mean, was it really the surge that we thought it was in 2020?
I would
because
say
this surgery has been around for many years, right?
It's been around for many years. I think it's people's aesthetics changed, like kind of like clothing styles.
Yeah.
So I would say, you know, like in the 90s, early 2000s, it was all about breasts.
Yeah.
Everybody wanted double Ds or, you know, really large breasts. That is, I think that trend has fallen away. Plenty of women still want breast augmentation, but they want to look more natural. Like they have a natural, relatively full breast rather than something like, you know, from Baywatch or something like that. But now a lot of focus is on the butt. Most of the patients that come in that I see that are asking for this, they do have kind of a small butt, you know, for their frame, and they just want to look natural. They want to look like they have a full butt that they were born with.
Yeah.
Rarely, but it happens. Some patients come in and they want like the biggest butt they could possibly get, which, you know, no judgment here. I'm happy.
No judgment at all.
I want to make a patient happy.
No judgment at all. But sometimes, if they get all of the butt they want and they don't have any legs to it, they do get judged in the grocery store.
Yeah.
Is there every time a doctor would suggest, like, maybe we should put some down here in your thighs too? I
recommend more so, maybe a little less in the butt. It's hard to make thighs look natural.
Yeah.
With fat grafting.
I've seen people saying like, "Oh, chicken legs
It's
and a
hard.
big old butt."